Welcome back. At the beginning of the Texas legislative session, lawmakers set out to once again expand medical marijuana access. Few conditions qualify for a medical marijuana prescription, but one bill aimed to include patients with chronic pain. Charlotte Scott spoke with one patient who says medical marijuana was a game changer for her and why she's disappointed more Texans won't have access.
Shelly Peebles has been using medical marijuana for 2 years. She suffers from chronic pain and PTSD after experiencing domestic violence. She says she couldn't sleep until she started taking medicinal gummies.
Yeah, it was a game changer for me, and I'm not really willing to go backwards anymore.
Peebles didn't like the way the drugs her doctors prescribed made her feel, yet she says doctors kept pushing them.
They were talking about, taking narcotics for the rest of my life. And I was not okay with that.
Patients can get a medical marijuana prescription in Texas if they have one of 9 conditions, like PTSD or cancer. Peebles says medical marijuana has helped manage her pain. Now, she wishes other Texans could have the same access.
This can help so many other people with so many other different conditions, and it doesn't seem fair. We could be doing a lot more.
A bill by Republican Representative Stephanie Click aimed to do more by expanding the Compassionate Use Program, or CUP, to include patients with chronic pain. It didn't go far in the legislative session, as Republicans focused on other priorities and campaign promises. Although it didn't happen this time, more qualifying conditions could be added to the CUP in future legislative sessions.
There's a lot of support, including among Republicans and conservatives in the state, for compassionate use, and I expect that that's where we'll continue to see, both advocacy and lobbying efforts going forward. And probably the biggest chance of there being progress.
Other unsuccessful bills sought to expand medical marijuana as well. One would have allowed certain veterans with combat-related injuries to get a medical cannabis prescription, and another would have increased the number of licensed distributors in the state. While the legislation didn't get over the finish line this year, lawmakers note that as research has expanded in the area of low-level medical marijuana, bipartisan support has grown, and they'll try again next session. For Capital Tonight, I'm Charlotte Scott.
With us now to discuss this further is Chase Bearden. He's the Deputy Executive Director of the Coalition of Texans with Disabilities and Director of Policy and Advocacy for Texas Patients First. Chase, nice to see you. Thanks for being on the program.
Thanks, Karina. We appreciate it.
You supported expanding the Compassionate Use Act program. Why do you think more conditions should be added to this?
Yeah, so our organization has a large membership of people with disabilities that cover a large population in the state. And the one thing we found is many of them just want choice. When you're having to take multiple medications, some are effective, some aren't. And for many people, being able to have a choice, it's another tool in the toolbox for doctors and patients to move towards first, besides needing to go directly to opioids or something else like that.
Yeah. This has gotten growing bipartisan support in the legislature. What do you think happened this session? Why couldn't lawmakers get it over the finish line?
Yeah, we have the votes on both sides. At the end of the day, I think what advocates and what many Texans need to do is reach out. We need to do a better job of really helping the lieutenant governor's office, their staff, understand the reasons of why having a good regulated medical market for cannabis is the best approach to the system. I think at the end of the day, putting our time into really working with the state leadership, we will get there.
You've personally spoken out about how the program has helped you. Can you tell us a little bit about your story?
Yeah, after 30 years of being in a wheelchair after an injury, one of the first things when you go to a doctor for pain later in life is opioids. That is the standard of care. So the first thing they did was start prescribing hydrocodone, and all they can do is keep increasing it. And when you're on it for over a decade, it's not effective anymore, and it's actually not giving you any benefits. What you really need at the end of the day is a better option than even starting with opioids. I think that's one of the things we should be addressing, is giving people a choice not to have to take them.
What about the research? I mean, some fear, you mentioned the lieutenant governor, the governor's talked about this too, but some fear that any expansion, even medical, will lead to recreational legalization. I mean, can you focus on one and not the other?
You can definitely. And, our organization has always pushed to maintain a medical program, because when you see other states that had medical programs that then went rec, you start to see the medical programs kind of dwindle. And not be as effective. So we've always pushed to maintain that it is a medical program. And at the end of the day, we have a very conservative program, a very conservative legislature who would be the ones in charge of deciding if it should stay medical or eventually go to rec. I think we're going to be fine in that the state will maintain a medical program.
Yeah.
We just need to get it to a point where it is actually beneficial to all Texans.
I know you will continue to push for this, as will the authors of these bills, and we will continue to check back in with you. Chase, thank you so much for your time.
Thank you. We appreciate it.
Thanks for watching our YouTube channel. For more refreshing stories about your community, click the subscribe button over here. You can also download our Spectrum News app and tune in to Channel 55 on Dish and DirecTV to get live news coverage, weather updates every 10 minutes, and more. We'll see you then.